Hello, my name is Miriam Gonzalez. This is Unit 4. Unit 24.1. Match the two parts of the sentence. Look at A, B, and C opposite to help you. 1. 1988 saw the UK launch of the liver atom. Is G. Pizzeria of unknown origin. True. Chickenpox varicella is a common infection. Is E. Disease of childhood. 3. Rabies has an incubation. This is H, which peak of temperature of 39.5 Celsius. 4. 5. He was admitted with a 4-day history of influenza, tired syndrome of fever with. This is B. Rigor, myalgia, and general malaise. 6. Quite a proportion of patients who recover from hepatitis B, C, become carried of the virus. A. Melons rubiola is smoked. D. Infection during of the cataract stage. 9. Lyme disease is caused by transmission. Is it G? Of B. Burglary from animal to man by using tick. 10. PUO stand for is I. Pizzeria of unknown original. Point 2. Complete the case report of the patient in A opposite. Look at A, B, and C opposite to help you. Case 45. On examination, he looked where his blood pressure was 1000 minutes. He has a palpable spleen. The combination of fever and rigor in a patient who has recently returned from Africa suggests a diagnosis of malaria. The incubation period is usually 10 at 14 days. In this case, the patient admitted he has not been taking prophylactic regularly. The diagnosis was confirmed by the presence of parasites in his blood film. Point 3. Complete the sentence. Look at A, B, and C opposite to help you. 1. An infection which can be treated successfully with antibiotics is curable. True. Another word for an epidemic is an outbreak. 3. Bacteria and viruses are examples of microorganisms. 4. Someone whose temperature is normal is affable. 5. The common infection with Epstein-Barr virus is not a glandular fever. Unit 25.1. Complete the table with words from A, C, and D, and E opposite, noun and adjective. Affect, affective, anxiety, anxiety, behaviors, behavioral, dementia, dementor, disturbance, disturber, suicide, suicidal. 25.2. May word combination using a word from each box. Two words can be used to look at B, C, and E opposite to. Behavioral syndrome, eating disorder, major depression, mental retardation, personality disorders, physicomotor retardation, sleeping disturbance, substance abuse. Point 3. Complete the sentence. Look at A, C, and D and E opposite to help you. The way a person behaves is his or her behavior. True. A persistent emotion state is a mood. 3. A sudden attack of anxiety is a panic attack. 4. The form of dementia aging is called Serming dementia. 5. A disorder which is not associated with pathological change is functional. 6. An idea which forces a patient to repeat unnecessary action is a compulsion. Point 4. Which symptoms of depression was this patient suffering from? Look at C opposite to help you. Case 31. A 56-year-old woman presented to her GP complaining of increasing tiredness over the past 5 months. She has lost interest in more steam. She was sleeping poorly and tended to wake up early, but denied any sexual tendency. She was thirsty and was passing urine more often. She was eating normally and her weight was stable. The patient, the answer is, the patient has three of the least symptoms. 1. Tiredness, fatigue, loss of interest, and sleeping poorly, insomnia. 26.1. Complete the table with words from A, B, and C opposite. Adjective and noun. Blind, blindness. Conscious, consciousness. Deafness. Dizzy, dizziness. Numb, numbness. Read, header, light-headedness. University, university. Point 2. Make word combination using a word from each box. Look at A, B, and C opposite to help you. W vision, epileptic fits, prodromal symptom, signocal action, urinary incontinence, visual acuity. Point 3. A doctor is trying to determine the cause of loss of consciousness in a 52-year-old man. Complete the doctor's question. Look at C opposite and at the table in 26.1 about to help you. Do you lose consciousness? Student of graduating? Did you get a warning of the attack? What were you doing before you passed out? Were you worrying or under in the street at the time? Did you fear dizzy or lie hearing before the attack? Did you lose control of your brother? Did your wife notice any involuntary movement while you were inconscient? 27.1. Complete the table with words from A and B opposite. Now adjective. Accent, accent. Diminution, diminution. Flaccid, flaccid. Spatsy, spats. Western, western, western. Point true. A doctor is giving instruction to a patient during examination of the motor system. Identify what the doctor is asking in each case. Look at A opposite to help you. 1. I would like you to relax and just going to move your arm up or down more tongue. 2. Can I see your hand? More burr and possibly involuntary movement. 3. Now I'm going to straighten your arm out. Try to stop power. 4. Can you touch my finger with your and then touch your nose? Good. Now do it again with your eyes closed. Coordination. Point 3. Complete the sentence. Look at A, B, and C opposite and at the table in 25.1 about to help you. 1. A phrase had dropped limping to for a right angle with the grids. True. Bridge reflects that are stronger than normal. 3. Molecular wasting means the molecule is reduced in bulk. 4. A teeth is a form of involuntary movement. 5. A K is often used to test the banking plantain response. 6. His coordination was poor. He could not perform rapid alternate movement. 5. A tendon reflex hammer is used to test reflex. A. When something is diminished, it is less than normal. Point 4. A patient is brought to A and E in coma. When her name is spoken, she opens her eyes, but she doesn't answer questions or a body intrusion. What is the GCS score? GCS 5, eye opening to speak. 3. Verbal response now and motor response now is equal 1. 28.1. Complete the table with words from A, B, and C opposite English for verb, noun, and adjective. Cure, cure, curate. Excite, excitation. Grow, grow, growing. Invade, invasion, invest. Obstruct, obstruction, obstructive. Pilot, pilation, pilot. Purple, purpation, paper. Spread, spread, spreading. swelling. 28.2. The nouns belongs are about the patient described in B-positive. Use them to put the sentence 1 at 9 in the correct order. To make the next paragraph of the case report using appendix 2 of page 10, 20 if you need help with the operation. 30.8 Celsius is on examination his temperature was 37.8 Celsius. A small fear 344 mass in our cervical fossa is 3. There was a small fear 344 mass in the right cervical fossa. A small nose 1 at 2 centimeter in diameter, palpable in both axial and inguinal area. Is 7. There were long, limp nose in both axilla and inguinal area. Olfactory and AD is true. His mouth and throat were normal. P 1000 minus regular. BP 1011 at 16.6 is A. His pulse rate was 1000 minus regular and blood pressure 1011.66. At mass palpable semester below our costal margin is 5. On abdominal examination, there was a mass palpable semester below the left costal margin. CNC and X. NAD is 1. Examination of the central nervous system was normal. 28.3. Complete the sentence. Look at A, B, and C opposite to help you. 1. Distant spread of tumor cell is known as metastasis. 2. Many symptoms of cancer, such as difficult swallowing, are due to obstruction. 3. The opposite of painful is painless. 4. A mariner new plant is called a cancer. 5. Tumors which do not invade of metastasis are benign. 6. Secondary tumors are those which result from the spread of a primary. 7. If a cure is not possible, period, treatment should be given. 8. A palpable liver surgery metastasis. Point 29.1. Complete the sentence. Look at A, B, and C opposite to help you. 1. A baby that is born a week before the EDD is premature. 2. A termination of pregnancy may be necessary for medical reasons. 3. The first 2 months of training are known as the first trimester. 4. Fetal district in the first stage of labor in an indication for cesarean section. 5. It was a bridge presentation and delivery was by force. 6. A miscarriage is another term for spontaneous abortion. 5. 7. The umbilical was wound thrilling around the baby's neck and it was unfortunately umbilical. Cord stable. Point 2. Complete the table with words from A or positive. Verb and noun. Abort, abortation. Deliver, delivery. Induce, induction. Miscarry, miscarriage. Present, presentation. Terminate, termination. Point 3. Dr. Benio and S.H.O. is presenting a patient at a weekly meeting in the obstetric unit of a hospital. Complete the presentation with the correct form of verb from 29.2 above. This is Clara W. She comes the maternal clinic at the 9th week. In her past obstetric history, she was a pregnancy when she was 18, which was terminated, in another one a year later, which spontaneous abort. Since then, she has 3 pregnancies. In the first, the baby was delivered normally at 30 weeks. In the second, she has an induction of a labor at 39 weeks because of fetal distress. The third baby presented as a boyish and was delivered by cesarean section. Point 31. Make word combination using a word from each box. Look at A and B opposite to help you. Blood stained, breath sounds, pleural root, produce cause, and vocal resonance. Point 2. Rewrite the question using words that are better known to patients. Look at A opposite to help you. Is your cold productive? The answer is. Do you cough off any fragrance? True. What color is the sunburn? What color is the flame? 3. It is ever pudulent? It is ever yellow? 4. Have you ever had meningitis? Have you ever noticed any blood in it? 5. Do you suffer from dyspnea? Any problem with your breathing? Point 3. Are the following statements true or false? Give reason for your answer using your medical knowledge and A and B opposite to help you. 1. A patient who has a loose co-producing blood. True. It's true. Because a producing cow is often described as loose. True. Clasps are held when the airways are narrowed. It's false. Because clinicals trigger the presence of fluids in the lungs. 3. A patient who has enough products cough producing sputum is false because a cause may be non-producing. 4. Wheezing are typical or preceded is false because wheezes indicated narrowing of the airways. 5. A pleural root is a sign of asthma is false. The sound hard when the pleural surfaces are inflamed, as impulsive is called a pleural root. The over to you answer this case is this man has a pulmonary embolism. 31.1. Complete the description of Herbert Schuster singlet by replacing the medical word in the bracket with ordinary English word. Look at A and B opposite to help you. 1. Singlet Herbert Schuster usually start with pain and the sentence then red. 2. Spot maculate appeared the bell intergroup of a small blister over a peculiar area on one side of the body. In most patients, new spot bleeder lesion continue to appear for 3 to 5 days. The small bleeding become filled with pus, pustular, and then for scalp crush. In several cases, they may be scar cicatrices afterward. Point 2. Read the description of the right of rubella and complete the notes without A and B opposite to help you. The spores are scarring pink maculae which appear far behind the ear and on the forehead. The rats spread rapidly first to the sternum and then to the limb. Location and distribution. First behind the ear and on the forehead, then the throat and limb. Grouping. Scary. Type of lesion. Macular. Color pink. Point 3. Complete the notes for the rash in the photograph and suggest and diagnostic at A and B opposite to help you. Location and distribution with a spread on the chest and abdomen. Grouping. Scarlet. Style of lesion. A small macula with some scarlet. Color pink. Point 4. Complete the notes for the lesion in the photograph and suggest a diagnosis. Look at A and B opposite to help you. Location and distribution below lateral organ of the left eye. Grouping single. Type of lesion nodal and color white and pink. 32.1. Write the corresponding medical term for the ordinary English word and say what kind of the form is involved. Look at A opposite to help you. Common word, medical term, and type of forget. Bruising is contusion and bloom. Cut in zero word and sharp. Grace, abrasion, blunt. Scar, linear abrasion, blunt. Star wound, penetrating, sharp. Tear, laceration, blunt. Point 2. Choose the correct word to complete the description of the injuries shown in the illustration. Look at A and B opposite to help you. There are gray stars above the left eyebrow, and on the left side of the neck a contusion to the left side of the lower lip and tear to the left cheek. Point 3. Write a description of the injuries shown in the illustration. Look at and B opposite and 32.2 about to help you. There is acceleration tear on the left shoulder and indices were a good approximately 6 centimeters in left above the left nipple. Point 4. Complete the sentence. Look at A, B, and C opposite to help you. 1. Frequent changes of position are necessary in the immobile patient to prevent the development of a pressure sores. 2. He has several stabs, one in the abdomen from the sniff. 3. He was knocked unconscious by a heavy blow to the head. 4. The wounds were only superficial, are not treated. Point 33. 1. Look at the conversation in a positive and complete a note about Mr. Jones using medical terms where possible. 1. Frequency and nocturia for 1 year, not dysuria or hesitancies. Extreme failure a little weaker. No incontinence apart from occasional dribbling. Point 2. Match the patient description of their symptoms. 1 at 7, which the medical term A at G. Look at A opposite to help you. 1. I have to beat every half hour of soul frequency. 2. I get a scalding pain when I bath water, etc. 3. I have to get up several times to pass water at night. Nocturia. 4. I have to run to go to the toilet is urgency. 5. I have trouble wearing a star. Existence. 6. I cannot hold my water. Incontinence. 7. I pass some blood in my urine. Chatmaturia. Point 3. Write the total question for each of the symptoms in 33.2 above. Look at A opposite to help you. You will need to think of your own question for urgency. Possible question is answered. Frequency. How often is that? Dysuria. Do you get any burning, a pain when you pass water? Nocturia. Do you have to get up at night? Necessity. Do you have any trouble wearing a star? Inconscient. Do you have ever lost control of your brother? Have a nocturia. Have you ever passed blood in the urine? Urgency. Do you have to rush to get to the toilet in 2 minutes? Point 4. Describe the findings of the laboratory reporting word. Look at B opposite to help you. Blood more, protein more, cash near. The answer is there was a trace of blood, gross protein, and no gas. 34.1. A doctor is talking to a patient during an ophthalmoscopy. Match the under expression she used 1 at 4 to expression with similar meaning from A opposite A at D. Ring Mr. Ward because you have been having the headache. I'm going to have a look at your eyes, particularly the back of your eyes, the retina. I'm going to put a couple of drops in your eye, which will make it easier for me to see the retina. After a few minutes, you may finish your vision and be loosened. This will wear off after about an hour. I need to get rid of as much extra light as possible. This means closing the rings. Now, I would like you to look straight ahead at the clock. This takes a few minutes and your eyes may feel a bit tired, so you can bleed if you need to. I don't want you to let me look at the clock. The examination is done with dimmer light is 3. A topical mystical solution is 1. Toward distillation is 4. Fixated on target is 4. Point 2. Complete the intrusion. Look at B opposite to help you. 1. Graph the cuff around the patient upper arm. 2. Place the diagram over the area of the branching artery. Write the patient arm so that the branching artery is at the same height as the heart. 3. Close the barber on the pump. 4. Pump up the pressure to at least 100 9 mmHg. Open the bar a little and slowly deflate the cuff while listening and watching the pressure gauge. 5. The first sounds you hear is the front of the heart. Is the front of the bone through the brachial artery. The barrier on the gap at the point is the systolic blood pressure. 6. Continue listening while you slowly deflate the cuff. 7. The diastolic blood pressure is measured when the sound completely disappears. Point 3. Complete the test. Look at C opposite to help you. 1. Phlebotomy are especially trained in the talking blood. There are skilling of the vein puncturing the vein to take a blood sample. The grits, hand and foot can be used, but more often a vein in the inner part of the elbow is used. It is difficult to locate a suitable vein. The patient may be scared to make it fit. Or tourniquet may be applied on the patient if asked to pressure empty. This helps to stop the bleeding and prevents bruising at the site. It is important that specimens too are labeled correctly before they are sent to hematology laboratory where a full-blown count or other investigation will be carried out. Thanks.